And first up, we have social services agencies discussion. And we have with us mayor and council stakeholder discussion. We have Ms. Tiffany, director with the Washington County Department of Social Services, Ms. Danielle with Washington County Director of Maryland Department of Juvenile Services. We also have Mr. James Gossard, of Public and Information Officer and Special Assistant to the Director of Washington County Department of Social Services. Would you please join us up front? How's that running down there? And there are 4 chairs. If any of your colleagues or anyone else would like to come to the front, you can just pull a chair. Would you like to come, Derek, would you like to come up? If you want to grab a chair and, right here, yep. There you go. Hello.
Hello.
So we invited you, and I'll just kick it off with just a welcome, and thank you so much for being here, especially on a Tuesday after your work day. And if you want, we just want to know what it is that you do, what services you provide, and then if it's okay, council can ask some questions, and maybe even if you guys want to start and give, does any of you guys want to say anything before we get started? Councilmember Asher, Kareem?
Thank you for being here.
Okay, yep. And if you just give us just brief summary of what you do and what services you provide.
So good evening, my name is Tiffany Rexroad. It's my pleasure to join you this afternoon to discuss the Washington County Department of Social Services, part of the Maryland Department of Human Services. In my 2 years as director, I have greatly appreciated the support our agency has received from the Washington County Commissioners and our city and county partners. It's also my pleasure to introduce members of our executive leadership team who are present with me today. Amanda Bishop is our Assistant Director for Adult, Child, and Family Services, and James Gossard is our Public Information Officer. We are happy to answer any questions that you may have. Also in the audience is Joshua Bond, our Assistant Director for Family Investment, and Jennifer Kane, our Assistant Director for Administration. I want to acknowledge members of our advisory board who are in the audience this evening, our board chair, Bridget Jones-Smith, and our vice chair, Shannon Gaines. The Washington County Department of Social Services helps residents buy healthy foods, pay energy bills, and obtain medical assistance. We also provide stable environments for children and adults. We have 240 employees across 3 locations in Washington County. Our primary office is located at 122 North Potomac Street in Hagerstown. I would like to take a few minutes to highlight the services we provide. For more information, our most recent report will be provided for you. The Safe Place Child Advocacy Center provides a multidisciplinary team approach to the investigation, prosecution, and treatment of child sexual abuse and severe physical abuse. The Safe Place is one of few locations in Maryland offering on-site forensic medical exams, therapy, and victim advocacy services to children and their families. It is the only nationally accredited child advocacy center in Washington County, located on Walnut Street in Hagerstown. Last year, the Safe Place assisted more than 220 families, including 265 children. Medically trained staff conducted 246 forensic interviews. You might recall from a recent presentation that we also provide outreach, prevention, and response to victims of labor and sex trafficking in Washington County. Our staff connected with 26 children and 9 adults who were determined to be at risk for human trafficking. The center works closely with our county agencies to serve victims of violent crimes, including the Hagerstown Police Department, the Washington County Sheriff's Office, and the Maryland State Police. The Washington County Family Center provides a variety of services designed to empower expectant parents and families through services including GED instruction, high school credit classes, family literacy programs, employability services, and health education. Parents with children aged birth to 4 years old learn to become self-sufficient through personal achievement, education, and positive parenting. Last school year, the center assisted 62 adults and 64 children. All teenage parents in the program remained in school, and 3 graduated from high school. Our Family Investment Division administers multiple state and federally funded programs. Some of our specific programs include temporary cash assistance, temporary disability assistance program, emergency assistance to families with children, and supplemental nutrition assistance program, which supplements a household's food budget. Program eligibility is determined by financial and technical requirements such as age, household composition, employment status, and housing costs. Applicants are verified. Last fiscal year, we distributed over $48.9 million in SNAP benefits for over 12,000 households in Washington County. This summer, we are proud to say we reached more residents than ever before thanks to Maryland Sunbucks, a federally funded program. Children who receive free and reduced price meals and families who already qualify for income-based benefits were automatically eligible for Sunbucks. The simple process helped feed more children during summer months when school meals are unavailable. Nearly 20,000 Washington County children received Sunbucks from June to August, a total of $2.4 million in federal benefits. From what we understand, this represents the single largest investment in Maryland's history to address hunger during the summer months. The work of our Child Support Administration involves support to both custodial and non-custodial parents, meaning parents who do not have custody. Each year, we work with an average of 5,500 child support cases in Washington County. Last fiscal year, our agency collected and dispersed $10.3 million in child support and arrearage payments. I want to highlight one specific program unique to Washington County, our County Alliance Program for Employment. This program is available to fathers without primary custody and teaches job readiness and helps them find well-paying jobs. Since January, 19 fathers have found employment through this program.
Good evening. We provide social work and case management services to ensure Washington County families, adults, and children are safe, physically and mentally well, and in stable living conditions. Child Protective Services investigates reports of children who are believed to be abused or neglected by their parents or their caretakers. Our goal is to protect children and intervene to help families improve their functioning. Last fiscal year, we completed safety assessments for over 3,300 children, including 111 newborns exposed to substances. We recruit, train, and license resource parents in Washington County, formerly referred to as foster parents. The goal of out-of-home care is to be a supportive resource not only to the child, but to their entire family. In fiscal year 2024, we approved licenses for 10 new homes, bringing Washington County's total to 48 agency-licensed resource homes. Family preservation services are critical to both providing targeted interventions to mitigate child safety and risk concerns and allowing children to remain safely in their homes and in the care of their parents and families. We offer kinship navigator services and resources to informal kinship caregivers who are relatives of the child to support and promote safety. Our kinship navigator offers services and resources to informal kinship caregivers in an effort to support and promote safety and well-being for children in Maryland. We have an adult services unit that provides disabled adults aged 18 and older with a range of case management, foster care, and aid services. Those services include personal, respite care, and chore services that are designed to help vulnerable adults meet their basic needs in independent settings. Adult services are voluntary except for Adult Protective Services, which investigates reports of abuse, neglect, exploitation, or self-neglect of vulnerable adults. Unfortunately, there has been an increase in financial exploitation of adults in our community by 12% in just this last year.
Finally, I will discuss multiple programs and community collaborations we have to support children and families in our community. The Family School Partnership and Early Intervention Program worked with 92 families, including 221 children, to connect children to resources to improve their academics, attendance, and behavioral needs. We facilitate a monthly multidisciplinary team, which is a standing partnership with local mental health agencies, the Department of Juvenile Services, the Washington County Public Schools, and other agency partners. We emphasize community shared decision-making and engagement. We're also pleased to work in partnership with Department of Juvenile Services in the implementation of the crossover youth model, which provides care coordination and collaborative case management for families who are working with both of our agencies. And our agency has been a longstanding partner in the implementation and ongoing collaboration for the ENVY initiative. Our work with this partnership has been to engage youth in the community. In conclusion, we hope this presentation reflects the scope of our programs and our mission in serving the residents of Washington County. When we receive child abuse reports, we assess the safety and well-being of children and adults in their home environments. We are proud to work closely with community agencies to meet the needs of this community. I want to close by thanking Mayor Martinez and council members for allowing us the time to discuss our work in assisting the citizens of Washington County.
Did you guys want to ask any questions or say anything now before Juvenile Services? I feel like she just shared a lot of information with us. If we don't jump in now, are you good? Good?
I'm okay till waiting till.
Okay, sounds good.
I'm fine to wait.
Okay.
First, let me say thank you for the opportunity to join you.
And Donna, I'm sorry.
That's
being,
okay,
Donna,
that's okay.
You have some too. as well, here.
Again, I just want to say thank you for the opportunity to join all of you this evening. Again, my name is Danielle Staley. I am the Washington County Case Management Program Supervisor for the Maryland Department of Juvenile Services. I am joined this evening by our Executive Director of Supervision Services, Derek Geddick. Both Derek and I have had the unique opportunity to not only work with you throughout the Department of Juvenile Services, but also through other organizations and programs throughout the county separately. So I believe I can speak for both of us when I say we appreciate the support across the city and the entire county for youth in so many forms, from government, non-government entities to private individuals, the time, the donations. There is an outpouring really throughout the entire county, truly. So thank you to all of you that are involved in that. It's our pleasure this evening to share with you just a brief overview of the Department of Juvenile Services. In an effort to make things a little bit easier and a little less complicated, we have provided you with a printed copy of a presentation so that you can just follow along with that. First off is our mission and our vision statements. And I wanted to point that out because these are fairly new. And the mission is to transform young people's lives, create safer communities, and form more equitable systems through community-based partnerships that hold youth accountable while building on their strengths and support systems. The vision, providing pathways to success for youth and families through partnerships across Maryland. And I want to point out a couple of things through that, and I'll come back to those later on. And those couple of things are community-based partnerships and success for youth and families. And we'll come back to those later on. At what age does the court have jurisdiction? The court has jurisdiction over youth age 13 and over who commit any offense. They have jurisdiction over youth age 10 and over who commit a crime of violence. A crime of violence is enumerated in Criminal Law 14101. So we don't get to decide, it is specifically enumerated in that criminal law. New legislation coming out in November does change that a little bit. So come November, you will see some changes in that. Juvenile court has no jurisdiction of youth under the age of 10, regardless of the offense. The only exception to that are sins and peace orders. Sins refers to children in need of supervision, and we'll get to that in just a moment. What types of referrals do we get through juvenile services, and who makes those referrals? We get referrals based on criminal acts, peace orders, various traffic offenses, and those SINS referrals, which are child in need of supervision. Those referrals come to us through law enforcement, various community members. Anybody in the community can initiate a referral to juvenile services, parents, and any child-serving agency. So that could be school, it could be DSS, any child-serving agency. So when we're talking about a SINS referral, these are, and this is especially important for those youth under 10 years old, because this is how we can get the services. These are those youth who are refusing to go to school, habitually won't listen to parents, completely out of control, dangerous to themselves. So juvenile services, with that referral, that SINS referral, can connect these youth and their families to services. And in some specific cases, we can forward that case to the court, and the court then may be able to order services in the community and may place those youth in an out-of-home placement, such as a shelter or a group home. Looking at some statistics, I'm not going to read all of these out to you. You guys have an image of all of that, but you can see 2019, we have gone down into 21. We have gone a little bit up, but we still are not anywhere near where we were pre-COVID. And most of our cases come from police referrals. The next one, just the types of complaints. The mass majority of our cases are misdemeanor cases. Once we do get cases in to juvenile services, staff currently have 25 calendar days to make a decision about intake. That does change come November 1st. We will then have 15 business days to make that decision. The choices at intake are to either resolve it at intake, make informal supervision, or send it to the state's attorney. So resolving it simply means that the youth is connected to services, but there's no formal involvement. Informal supervision means that we connect them to services and we supervise at the juvenile services level. It does not get sent to court. If they're not successful with informal supervision, we can then still petition that and send it to the state at that point in time. And then the alternative is to send it directly to the state's attorney's office. By law, if juvenile services gets a case that is a crime of violence, we are required to immediately petition that, and that case immediately goes to the state's attorney's office. We also do use a tool. It's not completely discretionary. There is a tool that's utilized to help determine what decision is made at intake. As far as the court process goes, once a case is petitioned and does get forwarded to the state's attorney's office, the state's attorney's office does have 30 days then to determine if they are going to go forward or petition the case. That court process then, there is an adjudication hearing. That's what otherwise is known as a trial, where the juvenile can be found involved or not involved. And also a disposition hearing. So if they're found involved, it goes forward to a disposition hearing, also known as a sentencing hearing, where the judge can impose an appropriate sanction. Individuals involved during that process of those hearings, the judge, the state's attorney, the Department of Social Services, the public defender, the youth and their guardian are involved in that process. The victim, if there is one, is involved in that process. They also have a voice. If the family is involved in a social services, they also are involved, so we get input from them. Board of Education, so if the school resource officer, if the counselor can provide input on the family or the youth, they're involved. Other law enforcement. So we try to get as much input as we can to provide the court before going forward on hearings. At the time of a disposition hearing, the court does have some options. One of the options is to place the youth on probation. For misdemeanor offenses, the maximum initial term of probation is 6 months. That term can be extended in 3-month increments, but there is a total time maximum for supervision of 1 year. For felony offenses, the maximum initial term is 1 year. Again, that can be extended in 3-month increments, but the total time for supervision is 2 years. And for crimes of violence, the probation can continue until they're age 21. During supervision, we do offer aftercare services. For Maryland, we offer multi-systemic therapy, behavioral health services. There is mentoring available. We also try to engage them in pro-social activities. We try to do outings with them, whether it's baseball games, bicycling. We try to do all kinds of different activities with them, educational support, vocational opportunities. And the department is also working on expanding services for young people in the community through a rural innovation team. So there is even more coming to the area. So that is one option that the court has at disposition. Another option that the court has is to order the court to out-of-home placement. Once the court orders out-of-home placement, the department then does an in-depth assessment to determine what level of placement would be most appropriate for that youth. And these are all the different levels that we have options for. But the court doesn't say this is what we want. They order out-of-home placement. A lengthy and involved assessment is done on the youth to determine what's most appropriate. And the last page is a link to the resource guide that provides a ton of different data. If you guys are interested in looking at that, that's updated each year. And then just some other links and information for you. And again, we were happy to answer any questions that you have.
Dave, did you want to say anything?
No, I think Ms. Staley covered. I'm here just to support any other questions that anyone may have.
Anyone else at the table have anything else to say? No. Who's on first? Councilman Usher?
I mean, I have a number of questions
Okay.
for each of the respective agencies. And the first question is, you know, I know that other council members with other entities that have met with us have referenced, you know, part and parcel to the purpose of these discussions are obviously the letter that we received that sort of said, hey, city, you're at fault for all the bad stuff that is happening in the world. And, you know, so, but then cited, you know, everybody else that does all the other heavy lifting, like yourselves, to try and make things better with us. And so, you know, I think it goes back to this moniker of, you know, all of this just happens in the city, right? Everything that's happening bad is only happening in the city. And I heard both of your entities refer repeatedly to the fact that you provide services to Washington County as a whole. And so if you could just touch briefly on sort of where you're headquartered and, you know, what you would deem, generally speaking, your service levels are across the county.
So for to divide like city and county, it's hard for us statistically because we can only divide stats by zip code. So in the 21740 zip code, you know, that could be inside the Hagerstown or outside the city limits. So we don't necessarily have that statistic as far as that goes. We do know that we have roughly 12,000 households that receive food stamps or SNAP in our county, in Washington County. We also try to make our best effort to go around the county to different events. Just the last year, we were at over 24 events throughout the county. We're really making an effort to be everywhere. there are people throughout the county, not just in Hagerstown, whether it's Keysville, Boonesboro, other places that need our services, and we want to make sure we're able to reach out to them and do that, so.
Danielle, can you answer that question, you or Derek?
So where we're located, to that initial part of the question, our county office is right next door at 44 North Potomac. And as far as young people, it is also difficult for us because cases come to us through referrals through multiple police agencies. And because that agency maybe makes an arrest or makes a charge, doesn't necessarily mean that's where that young person lives. And we also can break down by zip code, which then leads to the same issue for us. So the majority of our stats come countywide. And what I can say, looking at our stats in the past, I'm in a unique seat sitting here tonight, having worked the majority of my career in Western Maryland and Washington County, and now overseeing state operations, to be able to say, looking at statistics from our end, we have young people under our supervision in every high school in Washington County. So it doesn't stay local to North and South High in Hagerstown. We have someone involved in every high school in this county.
Thank you.
And I'm gonna ask this question of Mr. Stoner when he was here with the Washington County Health Department, because I think people get confused at times when they hear the term Washington County Department of Social Services or Washington County Health Department, et cetera. And so I think, the two questions that come from that for me are, one, are you funded by the county and or the state? And two, do you consider yourselves an independent entity, like an independent nonprofit, or do you consider yourselves directly an arm or agency of the state or the county or the state?
So for the Department of Social Services, we have funding, primarily state funding, a portion also of federal funding. And for our agency in Washington County, we also receive local support from the county commissioners. So we are funded federally, state, and through our county commissioners.
Do you consider yourselves an independent nonprofit?
Oh, no, we are a state
guess that's
agency.
the
We
primary.
are one of the 24 jurisdictions of the Maryland Department of Human Services.
We also are an executive arm of state government under the governor's cabinet secretary, and we receive federal funding through reimbursement programs and grants, otherwise no local or county funding to our office in Washington County.
Thank you.
Somebody else, I mean, I have other questions. But
I know,
somebody
but
else can
you ask them all and then
I
we
mean,
can just
and
check
then
off
we're
what
getting
we
all
have. I mean, I've got a list too. You go right ahead.
Do you both have boards, and how are those board members selected? Like, what are their?
Sure. So for the Department of Social Services, we do have a 9-member advisory board. To be a member of that advisory board, there's an application process. You apply actually through a county website, and then we screen those applicants, we do interviews, and select board members through that process. So we would invite any interested person from the community to apply through the county website to do that and to join our board. We anticipate at least one board vacancy in the early part of 2025. 2 of our advisory board members are here with us tonight. And we appreciate having their support and guidance on decisions and funding and other opportunities that we have.
We do not have a board.
Okay. And then one.
Can I
go
just
ahead.
add to that? I apologize. We do have a local detention center that houses females at this point only in Washington County. And that detention center that is run through the Department of Juvenile Services does have a local advisory board that is made up of community members from both the court and court members, as well as community advisory members as well.
Okay. You mentioned Safe Place, which I'm obviously familiar with, and you said it was a fairly unique certified accredited entity to Washington County. I was just curious, and maybe referencing Western Maryland as a general term, does that entity just provide services for Washington County, or does it provide it for a regional service?
The Safe Place provides services to Washington County residents. However, if there are youth or families that move from one jurisdiction to another in Maryland and had received services from another child advocacy center, so if we have a family that moves from Allegheny County and had been receiving services there, we could service them, but our program is designed to serve Washington County residents.
And the Western Maryland Children's Center does not just serve Washington County females. There are females there from all over the state of Maryland in multiple settings, multiple settings of care within that one facility, but they are young people from across the state.
And then you mentioned in your comments the foster program and that you have certified an additional 10 homes this year. I was curious because you said the total number of homes was 48, and I actually had a neighbor, well, we had a neighbor for a time that provided that care. They moved some time ago, but I was curious, I was surprised by the number of children that they had fostered during their time that they had, participated in the program. I was curious how many kids, if you know, generally, how many kids last year do you think you sent to foster care through the various issues that you had to deal with?
Sure. So I can say now that presently we have 135 children that are currently placed in out-of-home care through Washington County Department of Social Services, though not all of those children reside in this county because we have 48 locally licensed foster homes. We do not have enough foster homes in the county to support the need for out-of-home placement, and so many of those children are placed in out-of-home placements outside of this county.
Do you have any shelters or group homes here that aren't necessarily foster families? Are there group homes that you are able to refer to? And if so, how many do we have?
So there are group homes in Washington County. There are no longer any shelter organizations in Washington County, but there are group homes, Arc of Washington County, Oak Hill House. There is some transitional bedding at Brook Lane, but that's not considered a shelter. There has been a reduction globally across the state of Maryland in congregate care settings. The goal really is to allow for and to provide for every child to have a family setting and not to be in congregate care. And so we take the placement of children in group home settings very seriously because the desire is that every child should have a family setting.
Thank you.
I think that might answer my next question, which is you provided the chart on out-of-home levels of care and how you make that determination. I was just curious of those levels and those types of options that you have, whether you know sort of what's the most common within the county that you sort of land on.
Again, for us, it really is to keep them in the community, in with the family, if at all possible. So it is the least restrictive as possible, and only putting them in those restrictive if we absolutely have to. And Derek, you can talk with about what's available if you'd like to. But our goal is to keep them unified with the family if at all possible.
The vast majority of Maryland youth last year that were committed to out-of-home care through the Department of Juvenile Services went to a level 2 residential program, which occasionally, the best way to describe is more of a treatment setting without fences and locked doors necessarily. The doors may lock at night, but they're not getting confined to rooms. There's not fences with razor wire, that type of committed placement. That is the most common for Maryland youth as of last year.
Derek, what happens when the the young person comes out of foster care, comes out of the group home? Is there like some kind of wraparound service that keeps following the child in order to prevent something from happening? Or do they go back with the family? What happens?
Yeah, so young people in juvenile services care, reentry plan starts on the day of admission into the program to start planning for their return to the community with their family of origin. And sometimes through that placement, that plan changes. That needs to be a different location where they return to because of the offense, because of the nature of behaviors, the family dynamics, multitude of things can change that. But that reentry planning goes on throughout their time in placement, and work occurs with the family that they will be returning home to. And one of the things Danielle mentioned earlier is our desire to beef up that support to families. Because traditionally we've done a ton of work with young people and don't do a whole lot to support families and communities in a way that can make that sustainable upon their return. So our work moving forward through the leadership of our secretary now is how do we support communities in a different way so that young people can return successfully.
Does WCPS, are they in partnership with this reentry program into getting the kids back into life?
Every young person that comes back that has not already graduated or received their GED through their time in out-of-home placement is required by law to have a transitional meeting with the local school system. So I know in this county, Washington, WCPS has been great in conducting those transition meetings with our young people as early as possible and coming up with the most robust plan possible for that young person.
And my last question, sorry, Kristen.
No, you're good.
How is the recidivism? So have you been able to track that data as to the kids that kind of, oh, I'm making you look through your books, yes.
I can get you that info. If you'd like to go to the next question, I can get you that info.
I was gonna
very
ask
quickly.
if Tiffany or someone from DSS would answer the same question around the foster care. If you guys have a youth coming out of foster care, is there support, and what type of support is around that young person?
Always. So dependent upon the level of care that that child is in really determines the type of aftercare services that child or young person is going to receive. So for example, your question about a group home, lots of times there is a step-down process in which that child will go on a trial home visit, and there is intensive support that is provided to both the child and the family while they try out the return to the home to ensure that the child is ready, that the family is ready. Sometimes when children are in congregate care, they may step down to a lesser restrictive placement like a licensed foster home, where they transition back from, say, a congregate care placement in Baltimore. They may transition to a licensed foster home back in Washington County, get reacclimated with their community, get re-enrolled in their home school, increase visits with their parents. So it really depends on the need of the child. And then we individualize those supportive services based on that.
You good?
I think so.
So the number I can give you last year, that rate was 10%, and the year before was 6.7%.
Thank you.
So, when we met with the Washington County Public Schools homeless, child advocacy arm of their school attendance operations, I'm just curious, does everybody in your field define youth the same way? Because I think I was a bit surprised to find that they define youth to be beyond what I would consider the traditional, age of 17 and 18. So I'm just curious, as we're having this conversation and the listeners out there are listening, is everybody talking about the same thing, meaning a child being 17 and under?
So perhaps that depends for the Department of Social Services on the program. So for Child Protective Services, we would define a child as 18 and under.
Okay.
For children who are in our care and custody, for children who are in out-of-home placement, they can stay in our care and custody until 21. So for us, we would also consider a young person in our care to be up to the age of 21.
Yeah. I mean, I think that's interesting, you know, because folks just, I don't think usually see it that way. They, I think in the mindset you go, well, you're 18 and it's time to, you know, get out and get on your own. So I don't think we think of it that way when we think about services and how the courts may see them or how agencies may see them. So, now I'm going to ask a couple of questions that may sound a bit like curveballs, but I think that they are that because these are the rumors that we hear. And so I'm not asking it from the context of, hey, you know, I know this is happening, but it's more of like, you know, in the ether of social media and politics, et cetera. There's a couple of questions that I have here. One is, are you seeing, as county entities in Washington County, are you seeing any measurable increase in the number of non-local offenders going through your agencies and your programs?
We have not.
And then the second question is probably even a bit more left than that. Are you seeing any measurable increase of undocumented individuals going through your programs?
We have not, and all of our entitlement programs that we have, one of the requirements is to verify citizenship status. So no matter who applies, we follow all the state and federal guidelines for all of our all the benefits that we have.
We have not.
Not that I'm aware.
Okay. And then another thing that I think I found surprisingly interesting when we had the meeting some time ago with the folks from the county public schools, you know, and their staff's attempts to address truancy and things like that, are the number of youth living in hotels. I'm just curious, you know, if you see that as sort of a measurable concern or issue impacting your ability to provide these youth the types of services that you're referring to.
I would say from the child welfare perspective, regardless of where a family lives, they're gonna get the same level of intervention and service from our department regardless. And so we know in this community that there are large numbers of families that are living in hotels, and we provide services to in the same manner to them as we would a family that is in a single-family home or other residence.
I think maybe my question is, are you finding it harder to do that because they're having to live in a hotel or from hotel to hotel than you would in other circumstances? And if that's a noticeable thing.
I don't think it makes our job any harder. I think as long as we're in contact with them, they're providing us with information of where they are.
Okay. We've heard recently, at least I have, and I think it was mentioned at the meeting the other evening, not our meeting, that there were concerns that Antietam Academy, through the Washington Public Schools, has not seen a return to the level of enrollment that it otherwise could be post-COVID that would be able to assist in providing the educational setting for the kids that are in some of the schools around the county that should otherwise be going to a more regimented setting like Antietam Academy. I just wondered if
I'm not sure I could answer something about the school system. That's the problem. Maybe I'm not understanding it.
I guess maybe before COVID, I think we had this assumption that Antietam Academy, built by the school system, it's supposed to hold 250 kids. That's where kids go around the county that need that more regimented school setting structure. COVID comes along, everybody's learning from home. Then you got that first year back at school. I have 5 kids, so I know what that was like. Where schools just kids were having time to adjust back to that structured setting, and there did not appear to be an immediate interest or as immediate interest to sort of take kids that were having more difficult time adjusting back in that school setting off the Antietam and sort of letting that part play out. And it, at least the word that we have gotten, at least I've heard on a number of occasions, is that, Antietam Academy could be, providing educational services for up to 250 kids, but they're keeping it lower than it otherwise was before that COVID period. So I didn't know if you have interactions with the school, or if you have heard those same rumblings or experienced those same.
We have routine and consistent interaction with different staff at Washington County Public Schools, but I don't think we can speak to that. It's outside of our mandate as far as school placement and what that looks like, and I have not been in any conversations around that issue.
So I think for me, this is where the rubber sort of leaves the road a little, meaning that if we're going to sort of break out of our individual charges and collectively address the issues we agree exist, that I want to make sure, and I wasn't here last week, but I think that council had a fairly candid conversation with a number of nonprofits that we have to partner with to find these solutions forward. And I think for me, I want to make sure that if that's an issue, you know what I mean, and that's an item that's out there on the table, that our response is, and I think as we've said, whether it was the state's attorney's office we had in here, or the health department, or the nonprofits, et cetera, that we say, hey, if this is something out there, you know what I mean, in this realm of the things we're doing in this community to make things better, that we think, should be explored. I think for me, and please don't take offense to this, but I'd rather our response be, hey, maybe that is an item that we need to put on the table and look at. And I think often we, in our individual roles, step back and say, that's not our item, that's not our role. And so I just want to make sure that as we have these conversations, if that's an option that should be out there on the table, that we definitely, identify each one of them, regardless of what they are, and have those conversations, to see if that is a solution-oriented objective.
I'll tell you
that we
why
get
I
to.
can't speak to that, and that's, I believe there have been some recent changes in how Antietam operates. So I don't know if it's the change in how they operate, and that's the perception that's out there.
Right.
So unless
I got you.
I got more information, I just can't speak to that.
I think
So I
that's
don't want to
fair.
misspeak, or feed into something that's an illusion or perception that's out there. So
And I think you make
that's-
I'm sorry.
that's
I think
kind
you
of where
make
I'm
a
at
good
with that.
point.
Right.
We have consistently partnered with the school system and other community agencies through our multidisciplinary team process. So we routinely collaborate and think about what could we do, what could we do differently? What do we need to do in this individual circumstance? And so I think we have consistently tried to be a partner with other agencies. So yes, if there's an identified issue, we're always willing to come to the table. We may not be the solution, but we would love to be a part of the process to work together.
Absolutely.
And so for this body, I just want to say that we get a lot of, we get beat up, right, about everything that goes on within the city, no matter who oversees it, or, trying to explain that type of thing to 43,000 people or to the 200 on Facebook that have their minds made up or whatever is not something that we can do. But what we can do is kind of bring folks in here and ask specific questions just to clear the air on where we, as the elected body, and how we can partner or not partner. And so please don't feel as though any of the questions that the members of the city council are asking, because we don't feel as though you're doing your job or you could be doing your job better. It's not that. It's just we get emails about everything, from the school system to the crime, about everything, and the public is watching. And so that's the reason why specific questions, and it's not to say you're not doing your job or do your job better or you are doing a great job. It's not that. It's to literally make sure that we're addressing the things that we can address, and this is how we can address and make sure that the public and our constituents have access to the same information that we're getting?
I had a couple things. First of all, it was great to see all of you there. I've had a bit of an inside look. I worked in social services at a point in time. So I know the hard work that everybody here does, and I appreciate it. That said, much like Madam Mayor said, we get a lot of the same sentiment and a lot of the same questions. And to that, I say this with a friendly face. I do have a couple of things to that nature to address that were sort of insinuated also in the senator's letter. And the elephant in the room, I'd say, is we kind of touched on it earlier, but the location of services. So you guys are right next door. You guys are right up the street. We're all right here on Potomac Street, and then of course a safe place on Walnut Street. What barriers do you see, or what advantage do you see in the geographical location of being right on the main street here in town? Because that's what, I mean, I personally hear it. I'm sure the other council members and the mayor hear it as well, about the services being right on Main Street here in town. And
So one thing we'll say is with our location at 122 North Potomac is our main office, and then the safe place is on Walnut Street, is accessible by public transportation, which is a key for us because we want to make sure that all of our benefits are accessible to everyone that needs them. We have worked very hard to be out in the community at other places. We have the ability for people to apply for benefits online through the DHS portals. We have created email addresses and basically tried to make it as easy for people to reach us as possible. But there are people that don't have the internet and they need services too. And there are some people that their choice is they want to meet with somebody face to face. So we want to be accessible to them. So having that office on the public transportation route is a positive thing.
thank you.
How many different agencies would you say your average client? Because I think that speaks to that as well. And I hear that, from friends, that utilize services are the number of places, that they do need to go to, to meet people face to face and get the service they're looking for. It hardly ever is one single, agency. It's 4 or 5 or 6, and so I think that speaks to that issue.
And just for public clarification, social services, for example, there are many different services available in that facility. So
Yes.
Please correct me or add in, but child protective services, adult protective services, family investment programs, child support are all located there at 122 North Potomac, correct?
Yes, yes.
Okay, thank you. And I did have a question as well for juvenile services. I thought that the page on your presentation with the referrals, the complaint source is sort of a graph. It goes from FY19 up through FY23. I was curious if you had any thoughts. I see like FY19, there were 793 referrals to DJS. Do you have any thoughts on what the change, and it seems like a pretty drastic change in the amount of referrals that are coming in. Any thoughts on what would change that amount of referrals to service?
What I can share is if we were to go back FY19 through maybe FY15, that is going to look very stagnant. That number is going to be very similar across the board those years. And FY20 was the beginning of the pandemic, and FY21 was the heart of the pandemic, when everyone was doing things differently. So that is kind of leading to the uptick now as the world over the last 2 years has kind of, fiscal years, has reopened in a way to the way we view how law enforcement interact with families and young people in protecting themselves in the way that they were in the pandemic, how citizens are viewing their ability to make complaints about young people within their community, and the way the court handles situations that come before them as well. So I think it doesn't necessarily reflect that anyone is not doing their job. I think it reflects that we're viewing what criminality may look like and what other resources are available to keep someone from being tied to a system that they may never be able to get out of once tied to it.
Thank you.
I just want to say that every one of you at the table and every one of you in the audience, I have personally worked with, and you absolutely walk the walk. So each one of you have been involved in many of the things that I have done for outreach to the youth and for the community. So first of all, thank you very much. You absolutely do exactly what you say you're doing, and as a leadership team, I really respect that, so thank you. What do you feel, because you hear it, you see it on social media, you know the buzz, right? What are we missing? What are you and your organizations, like if nothing was impossible, what are you missing in order to kind of change that narrative and make it easier, make it better for our families, make it better for the youth? What do you think we're missing?
That is a good question.
I think from a juvenile service lens, that history has said our word now is accountable. We want to have accountability for behaviors, but traditionally it was punish the individual and then return to a community that we haven't invested in at all. And how do you expect change to occur systematically when you're not treating the root causes of the behaviors that you don't want to see? So how do we deal with the root and treat a community rather than the young person whose behavior you don't want to see? So I think for us is to get to a place that there would be support to say funding doesn't mean locking a young person behind a wall. And that's not to say there aren't people that need to be removed from communities for the safety of themselves and the community. That has to happen. There are people that need to go into facilities for treatment. But while that happens, how do we also leverage funding to treat the issue in the community and the family so that they can return successfully and the issues don't keep rising for you?
Thank you.
So I'm gonna say something that I've said to, people around, and that's when some of us were younger. I say some of us because I'm getting older now. It took a village. And we need to get back to building those villages for the youth as they come up. And for a long time, we have focused on that youth. And we need to reverse our thinking and start reinvesting in those partnerships, reinvesting in building the communities so that when these kids come back, they have that strong community. They have the village, they have those neighbors who know neighbors, and they have that village that is supporting them when they come back. So it's reinvesting in that community. So we have the coaches, we have the mentors, we have the tutors that are built into this community that are there supporting them when they come back. So if I had that, magic wand that Shelley talks about, it's rebuilding the village, build the village outward, so that we aren't just working on just the youth, we're working on the entire village.
Anybody else?
I would say from a child welfare perspective, I think any opportunity that we have for early intervention and early prevention efforts with families really is critical and key. I would echo the sentiments of it just can't be one agency, it just can't be two agencies. The necessity of community collaboration and partnership is essential to being able to do this work, as evidenced by the example you gave about needing to contact multiple agencies in this county to get certain needs met, and without those partnerships, we're limited in the reach in which we can do our work. And so from my perspective, from adult, child, and family services, it would be opportunities for early intervention, prevention, and an opportunity to continue to develop partnerships. Excuse me.
And how can the city help you guys? If we had a magic wand too, I'm sure you would say the same, but how can the city provide support for you guys, your organizations?
We have appreciated the supportive relationship that we have had to date, and we hope that that would continue. In the future, if we're exploring funding opportunities, we may reach out for a letter of support. We'd love that. We have a very active social media Facebook page. We'd love for you to follow our Facebook page, like it, share it. We routinely share employment opportunities that we have. We routinely share community events that are happening. We have links on there that are direct links so that you can apply for our programs. And we share other posts of what's happening in the community. So that's part of Jimmy's responsibility, and we keep that social media page very active. And then finally, we've talked about resource families in the community throughout several times tonight. We need foster parents. And if there are individuals watching, or you know of individuals who may be interested in fostering or being a resource to children in the community, we'd love to talk to them and have a conversation about what that process looks like. And as we work to also increase our support to kinship families and kin providers in the community, we want to be a resource for those families also.
I think too, promoting, stepping up, helping, be the leaders, being mentors, showing up, being part of the events and things, and just being those role models for the others in the community.
Thank you. I mean, we get, like everyone mentioned, we get questions all the time, and it's like, what can we do in this role, in this seat?
Send them our way.
Send them your way. No problem. Thank you, Bridge.
We will
Sharon.
find them something to do.
Can I just add, we also have social media, like, share, follow, and our state website lists our regional leadership team, our executive leadership team. If anyone has any localized questions, don't hesitate to point them directly to Danielle, but also to the website, to those teams. And then finally, we are working to spread a lived experience credible messenger program across the state. If you're aware of anyone that fits that mold, that can be in a place to have a better voice and space with a young person and family, direct them our way. We would love to engage people in that way. We've secured new funding to move that program statewide this fiscal year. So we would also ask for your support in that if you're aware of anyone.
Oh, we know a lot. Thank you so much.
First, I'd like to thank you all for being here, and especially Directors Tiffany and Danielle. I appreciate your thoughtful information that you provided. I also appreciate the questions and comments from council members and mayor. And because that's all been done, I'll be very brief. To me, there was two parts to this discussion. One part, which I think is more important and was done very well, was to help the folks in Hagerstown who are watching, who will watch, understand better the programs that you are doing and the work that you're doing. The second part of this, and from my perspective anyhow, kind of getting to the crux of the issue, as was mentioned earlier by Councilman Alshire, is why you're here. And the why you are here and why you've been invited to come and share all of this information and have this discussion with Mayor and Council is that our state senator, on his state senator letterhead, sent a letter to this Mayor and Council just generally saying that, as I think the councilman put it before, we're the reason that there are all kinds of problems, which obviously is not true. But in one of the paragraphs, the senator wrote, "End enabling and exacerbating the plethora of social services continuing to expand in the core of the city." End is a very specific word. Doesn't say modify, it doesn't say make it better or change. It just says end. And I think, at least speaking personally, but I think I speak for the rest of the members here, I took offense to that. I took offense to the entire letter, but I take offense to the fact that, as I've said with other groups and other individuals that have been before us because of this, It's like if you just go away, all the problems that exist in the city will follow you and just go away, which is ludicrous. It's absurd. And so I just want to point out the importance of understanding a few things. The councilman asked about your funding. I heard county, I heard state, I heard federal. It's not the city of Hagerstown. And I'm going to ask this question rhetorically in the interest of time. The city of Hagerstown, this mayor and council, does not direct any of your agencies, correct? Right. We know that's the fact, but just to put it out there and on the record. But the fact of the matter remains that the senator's letter was directed to this mayor and council. And so for several sessions, we've been addressing these issues, as the senator put it in one of his Facebook posts, which I don't tend to follow too much, but it just happened to pop up one day, that we're dissecting his letter. Well, yeah, we are. We're dissecting the letter because it's wrong. And at the end of this, I hope that this mayor and council has a discussion directly with the senator and presents all of the results of the work that we've done, the discussions that we've had, because putting something like this not only in the inbox of mayor and council, but posting it all over social media to just stir everything up and then take advantage of unfortunate circumstances which have not only, when crimes occur, not only are there subjects, but there are victims, and there are victims' families. And all of this nonsense that's happening, which I believe is political gamesmanship, is not taking into account any of the impact that this has on victims and victims' families. So I appreciate, again, the fact that you're here. I think you did an excellent job with your presentations. I hope everybody that was listening and within earshot of this transmission is taking notes and paying attention, because there is good work that's being done in Hagerstown. Hagerstown, I believe, is on the cusp of really great things happening in this community. And I'm not just talking about the bricks and mortar things. I'm talking about the true culture of this community. And I give this mayor and council, I'll say the whole term of this mayor and council, the credit for that. So thank you again for being here.
And we'll take it. I want to, first of all, most of you guys know that I come out of the foster care system. And the day after I was sworn into mayor, the newspaper said from foster care to mayor. And not foster care in another county, in Washington County. And as far as juvenile services, very truant behind a lot of different things. And so I also was with juvenile services. And I want to say, having lived experience, as well as working very hard to be able to sit into this seat and to be a part of this administration and to do the work that I know that we have done before as a council person and now as the mayor. I know what we have done, and I know that I understand politics and things like that kind of get a little bit, can get a little bit messy. But I appreciate the work that you've done. And if I could be a resource at any time, especially in 61 days, at any time to any of you guys, please let me know. I don't look at my story as a success story. I know that it's a success story, but I'm living in it. And as I'm living in it, it's not successful every single day. I have a daughter that works for the facility, which she enjoyed very much so when it was young men. Now that it's girls, it's a different type of thing for her. And so I have a daughter that goes to Roxbury Road every single morning. And I just want to say my family, when it comes to public safety and when it comes to making sure reconciliation and restoration is spoken into the families, it's what I do. And I thank you guys for your work, and I thank you for your partnership. Anytime that you guys have something that I can facilitate, you call me, and I appreciate that. And please keep doing it. And always remember that to have someone that has done this within this community is good news. It's good news. It does say that we do have a very, very interesting and great community. Like, how does someone like me go from the things that I've gone through to sitting here in this seat without it? You know, and so I thank you for your work. I thank you for your service to our community. Anybody? All right, thank you.
Thank you.
Thank you so much for coming.